We've got 5 minutes, so I'm going to we're going to do some speed answering. So Dr. Gratzer actually alluded to the first question already, which asks about the use of standalone apps versus those combined with integrated coaching or access to real-time therapy or use in conjunction with a clinician. So I think you already addressed that very briefly, that in fact, integrated apps are more supported in the literature. But the follow-up to this I thought was interesting, which is, what do you think such data could suggest about future demand for clinicians delivering in-person therapy? Do you want to take a stab at that, Dr. Gratzer?
Sure. I mean, you guys are in the area as well. You might have further thoughts. I think it invites us to think about some sort of a hybrid model. So just as we've used historically, for those of us who've got a few gray hairs, where we might have used resources like a book like Mind Over Mood, here we might use apps. And then that could augment what's being done with the therapist. The patient's really struggling with thought logs, and so she or he does that with an app, or it could be in addition. So somebody works with a therapist on several modules, but then the homework assignments is actually to continue to work with the app. When we did, I did a project, very briefly, I'll say, at Scarborough Hospital. That was the first project in Canadian Community Hospital. And what we found is the use of something online really helped us tailor to patients' needs. So instead of this cookie cutter approach, one group a week, it doesn't matter where you are in your journey, patients could really push forward or pull back depending on how they were doing, and in a sense tailor their therapy a little bit better.
Great, thank you.
Yeah, I guess I would just second that it's super important for us to be able to tailor these things to what's going on. Otherwise, we're just not going to see sustained use. So having that flexibility and confidence in being able to do that is, I think, paramount to making it successful, both for the providers and the patients. So there's just a lot of skill building, I think, that's involved with that.
Yeah, I would agree as well. And I think, in terms of our clinicians going to continue to deliver in-person therapy, I think that is absolutely going to be the case. And just to very quickly say, since a lot of us are doing telehealth now due to COVID, there are not differences in that. So whether it's in-person or telehealth, live is what we're really striving for, in addition to conjunction with apps. Speed dating here. So the next question very quickly. Combined with the risks of privacy and limited evidence, are we grossly overestimating what apps can do? Does the emperor have any clothes? Dr. Chan, you want to field that? Dr. Emerson?
Go ahead, Dr. Chan, if you want to do that.
Sure. The popular press and the mainstream media are going to hype things up when they're new. Apps are basically going to be like interactive ebooks or interactive material. And so you're going to have a gamut of pure garbage and pure gold and everything in between. So I wouldn't want to paint a broad stroke and say that all apps are bad, all apps are good. There are going to be nuances, just like websites, books, pamphlets, individual providers too, that are some of them are terrible and some of them are amazing. So, Dr. Emerson.
No, I think you hit just the popularity of it just sort of, brings everything to the forefront. I just don't think we appreciate there are a lot of different dynamics that are moving at the same time, and just to understand that. So yeah, it's a spectrum for sure.
Jumping to the next question. So the next question is one about diversity and kind of asks us about the app review framework. And without getting into too much detail, to just give a very quick 10-second answer, is we did have, real life experience on our panel. We had individuals who'd suffered with mental health issues involved in the process of developing it. But the 5-level process itself does not take into account any kind of underrepresented status or minority status. status in terms of how we evaluate apps. But I thought that was a great question. And just very quickly, in 10 seconds, the last question was about how long does it take for a new user to put an app through the evaluation? And I think it really depends on the app. There are some apps that we download and within 60 seconds, you don't need to go any further. And so really, in all honesty, the better the app is, the longer it's going to take to review it, because you're going to successively go through all 5 steps. But that said, a really high quality app can be reviewed in, I would say, 10 to 15 minutes, but I'll let you guys chime in before we sign off for today.
No, I think you answered it perfectly. It's exactly what happens.
All right. Well, thank you, everybody. I'm going to pass it back off to Ipsit now. Thank you.